guys, I am finally getting to talking about what to expect when you have laparoscopic surgery to diagnose endometriosis and what you have to do leading up to the surgery, because I had to go to multiple, or basically I went to 2 OBs in the process of getting laparoscopic surgery done. The first one, she wasn't allowed to do the surgery because my insurance didn't go to her hospital that does the surgery. So it took me about almost, I want to say 3 days or so to find a OBGYN to be able to, 1, see me, and 2, be able to get the surgery done and go to a hospital that took my insurance. I basically done all my research, and I found a pretty good doctor that I thought was pretty good, and the feedback that people gave him made me feel really good. And he actually is he is in a group for endometriosis, which makes me feel even better to know that the doctor that I chosen is familiar with endometriosis and minimal invasion surgery. So that makes me feel good knowing that the doctor that I have is specialty in endometriosis. So what I basically had to do was I finally made an appointment. It was like maybe a month after I made it. I was able to see him and got in there, told him what was going on. I've been to so much other doctors or OBs, been to GI specialists, and everything that's known to man that you could do. I've done a empty of my stomach. I've went gluten-free, which I still have gluten issues, but I went to the GI specialist because my old OB thought it was GI related because I was cramping 24/7 and nothing seemed to help relieve my pain. I was getting fed up with this, so he did an exam, and when he put his finger up me, I guess to see if I was in pain, and I was in a little bit of pain, but he wanted to actually schedule not say an ultrasound, but he wanted to do some test because I've had kidney stones in the past, if you're familiar with that, because I've had 3, and he thought maybe he would look to see if my kidneys are doing okay. And because like I said, I've had 3 kidney stones, and I believe the first kidney stone I've had, I feel like it scarred my tissue because that's when all these cramps, which was in 2012, was when I had my first kidney stone. And ever since then, maybe 2 months later after passing my first kidney stone, that's when all these cramps showed up. And I would not be able to take Advil, Tylenol, nothing. I mean, nothing. And nothing really subsided the cramps. So that kind of worried me because usually I've been able to take those and my cramps would go away. But so I've basically done everything known to man. So he decided to schedule my surgery because my old OB before him, because he moved out of state to practice in Australia, and I guess since my mom mentioned his name was Dr. Boward. He's the one that first told me about the surgery and how this was the only way you can really see what is going on, because I guess my form of endometriosis wasn't, I guess, progressed enough to see it in ultrasound. So this is the only way you could do it, was through surgery. Since my mom mentioned his name, he instantly clicked. he instantly changed because he went out and I went to go rechange, and my mom was like, are you going to schedule, I think it was I don't think it was ultrasound or something like that. And he's like, no, you're going to do the surgery. I'm like, oh, okay. So his nurse and boy, not signed me up, but scheduled my appointment for the surgery to get the laparoscopic at Keystone Hospital, which was December 19th at 11 a.m. Had to be there at 9:30 to do all paperwork and all that good stuff. So after that was set up, I got a phone call, I think about 2 weeks, 3 weeks after that. And it was a pre-surgery interview, which she asked you questions like what medication you're taking, are you allergic to anything, all that stuff. You couldn't take any vitamins, I couldn't eat anything past midnight. If I was going to do anything the day of the surgery, I had to, like coffee, I'd have plain coffee, water, Gatorade, all that stuff before 7 a.m. Anything in your system for 8 hours. So she asked me if I was allergic to any medication or any like allergic to any of the stuff like that they were going to do for the surgery. Talked about bathing and what stuff I needed to get because I couldn't use regular soap. I couldn't put deodorant on. I couldn't use anything that I guess smelled good. I had to take a shower the day before surgery and the day of the surgery, but I couldn't use any like foo-foo like soaps to wash my body with. I had to use antibacterial soap. I think it was this kind of soap that they use for when you're actually at the hospital when you are going surgery. I couldn't use any like any foo-foo, anything like that. She just asked me all those kind of questions and told me how to actually get there, which we're familiar with this hospital. So we did that, and basically that was it because I had to go to work, so she had to hurry up and tell me everything. But I had to wear comfy clothes. I had to make sure my mom was there because she couldn't leave because she was my ride home because they gave me general anesthesia, which you can't drive. So basically that was it for like the interview, and the interview did everything else. So now I had to wait for surgery, which was December 19th. So all that done happened. I got prepared. I got my underwear because you bleed the first day of the surgery, and you need pads. You can't wear no tampons whatsoever for a week. So I had to use pads and regular underwear. So that was the whole like really just everything. So that all happens. The day of the surgery, I took a nice little bath, enjoyed it, and got all my stuff together. Got my pillow because you're having surgery in your belly button to be comfortable. So bought my pillow, but we finally got on the way to go to the hospital. Get to the hospital, the outpatient pavilion. I check in, and I guess the financial lady that asks you all the questions, like sign paperwork there and all this stuff. I got my little check thing in, like one of the little bands, and then 5 minutes later, I got called to my room, which one of the nurses told me to undress and do a pee sample, and I had to literally undress. I had to get one of those cute little gowns, so I had to do that. And after I went to the bathroom and did all that stuff, got undressed, laid in my bed, watch some TV a little bit, and then comes vitals and ask me all the questions, and get used to people asking you what's their name, date of birth, and what's this procedure they were doing. Get used to that. I got asked that question like 5 times, it felt like. So she asked me all the questions, if I was allergic to anything, all that fun stuff, and then she put a IV into my arm. See it, but she put it in here, so when they do the anesthesia, they'll be able to put it in here so I can go night-night. So basically, she got done asking all that question, and then I had the general anesthesia guy come in, telling me what he's doing, what he is using, all that stuff, asking if I was allergic to anything, if anybody in my family's had any side effects or didn't take the general anesthesia very well. After he came in, my doctor came in, asked me the same question, what's your name, all this stuff, even though he already knew what my name was and what he was doing. So he came in and just talked to me, and I asked him to tell me which stage my endometriosis was when the procedure was done with, and he came in to tell me that surgery was going to be behind. I was supposed to have surgery at 11, didn't end up having it till 11:30 because the people that were in front of me, I guess, had complications or something. So they pushed back my surgery till 11:30. So 11:30 comes around, the actual nurse that takes me into the operating room, Melissa, she came in, wheeled me to the operating room, asked me my name, all that stuff, told her, get into this bright-ass operating room with all, like, the light bulb lights, the TV, where they see where he looks at when they go into my stomach. As soon as I got in there was, like, a freaking narrow bed, like, this narrow, like, my arms would fall off on it. So I had to roll over on there, and they put a heating blanket on, I believe, and they had these, like, little balloon thingies right here that, I guess, to help prevent blood clots. She turned that on, and then they put these little things on the side so I'd be able to put my hands on better, blanket on top of me, and strap me in so I wouldn't fall, I guess, because it's such a narrow thing. And then we were talking, just keep me at ease, and then 2 minutes later, there was a lady comes in, she's like, oh, I'm sorry I'm late, and she was like, will you go by Beth? I'm like, I don't care, it doesn't matter. And then next thing I know, she's like, I'm setting up for your cocktail, and I start feeling a weird sensation. She put the cocktail, the stuff that she puts you to sleep, in, and next thing I know it, I was in the recovery room, mom's on the right side of me, I'm in pain, and a little loopy, because like I said, I was on local or general anesthesia, and I was very nauseous, in pain, because that's normal when you come out of surgery. The nurse, Melissa, I believe it was Melissa, she gave me some nausea medicine and more. I think she gave me more pain meds, because I think that she gave it to me at 1:15, and which made me feel a little bit better. I feel like I had to go pee, so they put like that little pee cup underneath me, and I just couldn't, I guess I couldn't go. I guess that's just the pressure because of the gas they put, the H2O that they put in your stomach. They can see into your abdominal wall or your abdominal. So yeah, so I stayed there for, I want to say another hour, because we stayed till 2:40, 2:50, close to 3 o'clock. And so we finally was able to leave. She helped me put my clothes on, dressed me, and helped me up. We did like maybe 1 or 2 laps, 1 lap around the little patient area. She put me in a wheelchair, took me to my mom's car, and then we drove to Publix to get my prescription, like my pain meds. And I went in with my mom. It was very hard to walk because, like I said, I just had surgery, and it was very hard to walk. But she was next to me. She made sure that I was okay. So that's basically it. Came home, and that was when the real recovery started. And if you guys watched the vlog before this, you know it was pretty rough. Like, I had to get up every hour on the hour to do a little walking, and it was so hard to get up out of my bed. That was probably really hard. Extremely bloated, and I had the gas pain in my shoulder, which people warn you about. It was just miserable. I didn't have no bowels for 3 days, so I took a light store softener to help. Finally went to the bathroom the third day, and I started feeling a little bit better, but I was still in pain. But the best advice I can give you guys, whoever does do the surgery or get it done, that you need to walk. Walking is going to be basically your best friend. Walking is going to be your best friend. Moving around and just resting helps tremendously. Like, it helps so much. I cannot stress that enough. And you need to listen to your body when I say this, because I noticed I've seen people on these forums, they go back within 3 to 2 days after the procedure. Listen to your body. I don't care if you feel okay to go to work. I don't care what you say, because you are going to be in pain. And the third day was probably one of the worst, besides the second day, was probably really painful. And they say you can go back in the third day of surgery. I'm like, no. I want to say I started feeling better maybe day 5, day 6, but nowhere near to actually physically go to work. I was able to actually get out and go, like, walk around, go to Walmart and get a couple of stuff. But that was basically it. Like, I am not going to walk until Thursday, which is January 3rd. I'm still not healed. You're not going to be healed for a while. And my OB told me I can't lift heavy, more than 10 pounds, for 2 weeks. You need to recover, guys. I don't care what you do. You need to recover this, because they mess with your stomach. And if you don't rest, you're going to do more damage to your body than you think you will. So I honestly suggest you guys, take it easy. Don't overdo it. Walk around, go to the bathroom, go to the kitchen, do some walking, but don't go to work 3 days after. I requested off 2 weeks in a day. And I'm hoping that's going to be enough, because my stomach is still pretty sore. And most important thing, you cannot take baths, only shower. It's been 2 weeks since my procedure, and I cannot take a bath till another week. I take showers, but I can't sit in the tub for another week. Which makes sense, because I'm not fully healed yet, so I can't really do that yet. One of my incisions are still, because they took out the stitches today, but it's still, water could still irritate it, so I can't take baths yet. I can do tampons now, but the first week you cannot use tampons, only pads, and you do bleed the first day pretty heavily, like you're on your period, but you're not. And speaking of period, they say that your first period after the laparoscopic surgery is going to be pretty painful and heavy. So that's probably what I'm really worried about, because I have a week and a half left of my pills left until my next one starts. So that is not going to be fun. But we will see how that goes. And since today was my second post-op appointment, there's 3, I think I've mentioned this before, but there's 3, I guess, treatments or help not have this endometriosis be worse. 1 is the pill, which I'm on it. 2 is where you don't take the pill and you take this, I forgot what he said it was, but it's supposed to help with the pain and help ease it. And you can't take your pill, you can't take your birth control pill. Basically, it's one or the other. And then there's another one that they put it in your arm. I think it's like Nectrum, I think it's called. And you don't have your period for 3 months, and you have hot flashes. And then you go back on the pill after the 3 months is done with. He doesn't know what to do. He doesn't know what he wants to do with me yet when it comes to that. And I don't think I want to go down that road. But we will discuss that when that time comes, because I think my pills are basically helping me pretty well, because I only was stage 1 endometriosis. So I think I'm okay with that and staying on that. But speaking of endometriosis, like I said, he wasn't able to get all of it gone because some of my endometriosis was around your kidney tubes. Usually when endometriosis is on a organ or near an organ, something like out of your like kidneys, bladder, stuff like that, your bowels, stuff like that, they don't want to mess with that, because if you mess with that, it could really destroy you. So when it comes to that aspect, they can't do nothing for me other than treating it with my birth control pills, because there's no cure yet for this disease. So I'm going to be stuck with endometriosis, and it comes back as well. But it sucks that I still have it, and that it's still there. There's a lot left, but there was still some behind that he left because of where the placing was, and he didn't want to mess with that, so he just left it there. So I still have it, and which I understand, because I wouldn't want him to mess up or screw something up that could potentially hurt me even worse. So I'd rather have a little bit of endometriosis left in my body. The fact that I know that this is causing my pain, I care that's still there, but then I don't care, if that makes sense. Like, the fact that I know what was causing my pain for 6+ years makes me feel like I'm not crazy. So I'm okay with it still being there, I guess, because I know that's what is the cause of my cramps. Too mad, but I still wish I could live at least a year or something without having to have constant cramps and dealing with that. I just wish I could find a better way to ease the pain, because nothing helps me anymore, which makes it even harder. But it is what it is. It's part of being a female, I guess, and it sucks. Sadly, it's something that I'm going to have to live with until they get a cure, because they don't have a cure for it yet, which stinks, but it happens and it sucks. But I am actually going to type in and give you guys a better explanation in what endometriosis really is, because I know what it is, but I want to give you guys a better definition of it. So I'm going to pull up something real quick and I'll tell you guys exactly what it is. I found a good definition of what endometriosis is. Endometriosis is the presence of tissue that normally grows inside the uterus womb in a abnormal anatomical location. Endometriosis is a very common and may not produce symptoms, or it may lead to painful menstruation. It has also been associated with infertility. Endometriosis occurs most commonly within the fallopian tubes and intestines, and anywhere on the surface of the pelvic cavity. It can also be found less often on the surface of the liver, in old surgery scars, or very rarely in the lungs or the brain. Endometriosis occurs in the reproduction years. The average age at diagnosis is 25 years. Endometriosis may be suspected by doing a physical examination. It is confirmed by surgery, usually laparoscopy. Available treatment includes medication for pain, hormonotherapy, and surgery. So that's basically what it is, and it happens when you have your first period. And it can get worse and worse as it grows, because it does grow and it does move on to other parts of your organs or other parts of your stomach or whatever. It says it might appear on old scarring from previous surgeries or just scarring in general, which I'm thinking that maybe me having my kidney stone, it scarred as it was passing. So maybe it hindered onto that, because I had my pain on my right side, and that's where the endometriosis was located. I find that very interesting. So maybe my kidney stone is part of the cause of this, even though endometriosis isn't caused from me having my kidney stone, because endometriosis is related or part of the reproduction, like your period, and then female related. So kidney stone was on a separate thing on its own, but I think since I had scarring from that, my endo latched onto that. Good into this video of me talking about what to expect, surgery, what endometriosis is, and what the treatment option is, and all that stuff, because it's not curable. It can't be cured unless they find something, but I don't think they will, because endometriosis has been around for a long time. But if you have any questions for me or anything like that, please don't hesitate to message me on here or on my email. I'll give you guys both options. I'll give you guys my email here. But I hope you guys get some justice and feel that I just helped you. I hope you guys like this, me just showing you or telling you guys on what to expect and all that fun stuff going into your surgery to find your diagnosis of endometriosis. So stay tuned for future videos on this matter. If you have any questions, please comment below and email me if you have any questions. So I'll see you guys in the next one. Right or wrong, I read over what I wrote to you guys, and only way endometriosis will attach to a scar area that's already there is from surgery. But since I only suffered from kidney stone, I don't think that the endometriosis was attached to that part of my stomach, but I still feel like the kidney stone did do some scarring, so I wouldn't be surprised if it didn't adhere to that area, because that's where it was located, and that's where he didn't get it on something else. That any trauma that you had to deal with, which causes scarring, that could be another reason why the endometriosis attached to that. So I did read that. So that could be a possibility, yes, too. So I want to get on here real quick and tell you guys that real quick. But I hope you guys enjoyed, and I'll talk to you guys in a little bit or in the next vlog.